mathematical statistics are that apparently if we could get all 40 million worldwide HIV-infected patients in care and get their viral load down and maintain that within 60 years, so 3 generations, we could eliminate HIV from the world, which doesn't seem such a challenge considering that we've been able to eliminate simple diseases like smallpox. Some general health issues about just getting old, whether you're HIV positive or negative, but let's talk about probably the biggest issue in HIV positive older men and women is coronary artery disease. Coronary artery disease is not just your cholesterol. It is an inflammatory disease, and HIV drives inflammation. I think everybody should be on a statin, personally. These drugs are incredibly safe, relatively inexpensive, and are very effective. I think that all men should be on an aspirin for prevention of heart disease and stroke, unless you happen to have a bleeding issue and you can't take it. For women, the data is not nearly as good, and I don't push aspirin on women. But for men, all of my patients who are certainly HIV positive are on a statin and an aspirin.
And the big thing here is knowing the indication. And the indication means, what are you taking this medication for? Why are you using it? How is it being used? How often? I noticed that with a lot of our elderly population, and especially those in their 80s and 90s who are on medications, they were brought up in an era where the physician knew everything. You went to them, you didn't question it, you just took the medications. We're now taking a bit back, and we're trying to put this much more into the consumer hands as well, so that you know what you're on. Because before, it used to only go to one physician, and that physician took care of everything. Now you have your dermatologist, your gynecologist, your ophthalmologist, you've got your internal medication, you've got your surgeon, you've got your podiatrist. All these people can be prescribing medications, and if we don't have a centralized location, this is where a lot of damage can occur with drug abuse and drug misuse. One of the big things I want to give everybody permission here for is to be an effective consumer. Just because you have been prescribed a medication and I'm filling it for you or I'm dispensing it to you, you have the right to know everything about that medication, not just what it's being used for. But one of the big things here is understanding any of the side effects or potential side effects of those medications. There are certain drugs which will work together. There are certain drugs which will not work together. So consult your pharmacist, consult your physician or your healthcare provider, and read the patient information. Most pharmacies, by law, when you get a new medication for the first time, will have some sort of document that goes along with it.
The metaphor that I use a lot with my patients in terms of finding the right provider is, we don't typically wind up settling down with the first person we go on a date with. We wind up, shopping around a little bit. You probably went on a handful of dates if you wound up, settling down with somebody. I really encourage people to feel the same way in terms of picking a primary care with that. If just because your insurance assigned you to see somebody, or just because you got an appointment with a certain person at a health center or at a practice, that doesn't necessarily mean that that person needs to be your provider. If for any reason you don't feel comfortable, you should switch. And you should keep switching until you find the person that you feel safe with. Sex is, you have to be able to tell your provider what kind of sex you're having, what questions you have around it. And I mean the specifics. This is historically something that, socially we haven't really talked about. We tend to get a quick birds and the bees conversation with our parents at some point, and then from there you're kind of on your own. Maybe you talk to some of your friends about it. But, there isn't just one kind of sex. The sex we have changes over the course of our lives. And particularly when we're talking about, aging populations, I think that there's a societal expectation that people, that older populations aren't having sex. And of course, we all know that that's not true. Dr. Stern talked a lot about STDs. STD screening is something that, basically for the entire time that you're having sex, especially, for folks who are in, non-monogamous relationships or have multiple partners, STD screening should be a kind of constant part of primary care. STD screening completely changes depending on the sex that you're having. If you're only having oral sex, we need to be doing gonorrhea and chlamydia testing in your throat. If you're only having, vaginal sex, then we need to be testing your urine. So, it really requires people to, kind of do a little dirty talk with your providers, and I really encourage people to do that.
So the Ryan-White Act is the Comprehensive AIDS Research Emergency Act, and what it does is a federal rule that provides funding for HIV treatment and prevention. It was first initiated as a way to deter people from intentionally infecting others. So as part of the mandate that the federal government had in order to release funds to the states, they required that states create laws criminalizing non-disclosure of HIV status, but more importantly, not the intentional exposure. Intentionally exposing someone, or at least proving that, can be a little difficult. So what we have seen in many states is that intentionality doesn't really matter. For the most part, it just has to be the exposure. And the exposure really means just being HIV positive and engaging in sex in many states.
Part of it.
So all of these laws, for the most part, these laws are not HIV specific, but because of the person's HIV status, they are treated with more harshly.
Right.
And my theory, and many other people who have to work in this area, believe that any other sexual transmitted disease would be considered the same. Now the thing is that with other diseases, the stigma isn't as strong as it is with HIV. So the liability defenses. What I mean by that is, like, what are the things that I can do in order to protect myself should I be charged with a crime relating to the non-disclosure of my HIV status? So, we have talked about really the harm reduction, using condoms correctly, consistently and correctly, being on HIV meds, being on ART, will reduce a person's viral load to undetectable, which means that the risk of transmission is eventually close to zero, or pretty close to it, 99.2%, something like that.
Yeah.
And then ultimately, the disclosure of one's HIV status can be a defense in many instances.
Lack of experience and knowledge. So for some of us, actually most of us in this country, we are not taught how to communicate about sexual things, period. Right? How many of you had comprehensive sexuality education at any point in your academic career? And I will tell you that applies typically regardless of what age crowd I am talking to. There's no one way that works for disclosure for everyone. And that's important to remember too. Because what's right for me may be very different for what's right for you in these conversations. So I'm going to give you a couple different options, and I'm going to give you some tools to take with you that if it's right for you, you can use those in ways to disclose not only about your STD statuses, but also what you like, what you don't like, what your preferences are, what your relationship status is, because that all comes into it as well. And he came up with this 7-step, and I'm going to add an extra step in here, to talk about what your STD status is, when you've been tested, to talk about your relationship statuses and possibly relationship agreements, safer sex needs and whatnot. So we'll go through it, and then I'm going to model it. So I'm going to tell you my safer sex elevator speech, and then I'm going to ask you all to turn to people around you and practice yours. So keys are to talk outside the bedroom. So talk about these things before you get into the moment where you're about to have sex or do whatever you're about to do, right? Because bringing it up in those moments is extremely vulnerable. If I'm already excited, possibly naked, and ready to go, it's going to hurt a lot more if I'm rejected in that moment than if I'm rejected earlier in the night where we're just talking.
I make a point all the time in my practice to separate HIV and STDs. Think of them as two completely different concepts, and we'll talk about them as two completely different concepts. The first thing that I want to talk about around disclosure is around the medical aspects around HIV and HIV transmission. So I know we've kind of touched on this a little bit already, but there are a handful of ways that we can really dramatically reduce the likelihood of HIV transmission in a serodiscordant relationship. So in a relationship where one person has HIV and the other person doesn't. The first and seemingly obvious, but it makes sense, we have to point it out, is getting people tested, having people know what their status is. So when somebody has, when somebody's aware of what their status is and we're able to get them onto proper medication, we know that they are far, far less likely to transmit the virus. And that's regardless of use of barrier protection or use of PrEP or any other safer sex approach. So STDs, right? Everyone wants to talk about STDs. So yeah, they're absolutely, we have seen an increase in STD diagnosis. I've seen a lot more syphilis, I see a lot more gonorrhea and chlamydia. Of course, we don't know, is it because we're looking more, is it because people are having riskier sex? At some point, somebody will figure that out. It ultimately doesn't matter too much right now because STDs, for the most part, are easy to manage. So it also, we know that much like, if somebody has an STD and is dealing with that, the likelihood of HIV transmission is higher. And similar, Hep C and HIV can kind of piggyback. They're both chronic, unless treated. Hep C is curable. But when they exist together in a human, they kind of feed each other. So the Hep C makes the HIV more aggressive, the HIV makes the Hep C more aggressive. So the great thing is that we can get rid of Hep C now. Actually, very easily we can get rid of Hep C. Anybody who's positive should be getting an annual Hep C test, regardless of risk factors, because of how the two viruses feed off of each other.
So today my goal is to help you to learn some new strategies and some things that will help you to live a better life, live healthier. If you're after weight loss, I've got a lot of great ideas for losing weight, being at your best, and also helping you with your health, since we're here concerned about HIV and living our best with the HIV disease. I've been positive for 25 years. And thankfully I'm healthy. I pretty much have maintained a healthy lifestyle, and I think that's been a big part of staying healthy with HIV, is the way eating and exercising on a regular basis. I think it definitely enhances your overall, your health. Doing short, what we call high intensity interval training, and that just basically means you go fast and slow. So if you walked really fast for 1 minute and then just walked at your normal pace for 1 minute, that really does a number on getting your metabolism up, helps your body to burn more fat, as opposed to just going long and slow. If you think of it as a car that's driving at stop and go in the city, uses a lot more fuel than a car that's running on a highway. It's not super expensive to eat healthy. I know sometimes when people say that,
a lot of times people, when you think of the term mental health, that there's a negative connotation to that sometimes, stigma that's attached to that. What I really like to say as a therapist is I'm really about helping people maintain emotional wellness, right? There are things in our lives for all of us that happen that may knock us off balance as far as our emotional wellness, right? And so it's our responsibilities, I believe, as individuals, that life happens. Things are going to happen in our lives. It is our responsibility, and no one else's, to make sure that we get the support that we need to be able to maintain our emotional wellness, because it is a life better lived when we feel good, or as good as we can, about the context of our lives. So some of the things here that can help you manage your depression is, have you talked with a friend, family member face-to-face, right, in any given day? So face-to-face is important as well. Like, the phone and the technology is good, but it really can be helpful to have, it's a more qualitative connection when we're actually sitting down face-to-face engaging with someone. So really trying at least once a day or at least a few times a week to be able to be face-to-face with someone and having a conversation with them. Have you stopped being so hard on yourself, challenged any negative thoughts that we can sometimes, and what's for any of us, no matter what our age is, can sometimes have a lot of destructive thinking, negative self-thought. And so those things can really eat away at who we are and at our emotional wellness, right? So really trying to reframe things and to try to look at things from a more positive direction if you find that you tend to skew to the negative.
Breathing. I'll give you 4 things to do with. Deep breathing, mindfulness meditation. Mindfulness meditation is simply letting the mind be free of all of the trappings. Just letting the mind be soothing and peaceful and tranquil. That is mindful meditation. Visualization, spiritual principle and practice. Start to look and see the world that you want to create. We have a whole lot of violence in our world right now. Turn off the TV, y'all. Stop looking at that TV over and over again. Because what it does is it brings violence into your spirit. And we talked about anger, depression, and anxiety. The things that we are bringing into our spirit, like looking at this media, is the things that are tearing us apart. And so the way to healing is repeating a mantra. I am well today. I am well. Let me hear y'all say that. I am well today. I'm going to be well tomorrow. Yes, man. I'm going to be well in the Samana next week. Spiritual wholeness is, first of all, you have to see yourself as a whole person. A lot of times our society, and especially for LGBTQIAP people or people living with HIV, we are not considered as being whole people. We're considered as being fractured, or we're considered as ill, or we're considered as something less than. But the reality of it in being created as who we are in our personhood is that we are really great people. And you have to start telling yourself that you are something special, that you're more than ordinary, and that something about you is very important.